Welcome. Today, you'll learn how to respond in a variety of emergency situations by going on missions. These missions take place in different locations and cover the things that any responder needs to know to take action and provide care. Be prepared for anything. Up here is where you can toggle between the CPR AED mission menu and the first aid mission menu. We'll start in a level 1 mission. I'll help you get started and go over the basics of the check, call, care process as you work your way through this level. Once you complete the required missions in level 1, you'll unlock level 2. These missions are a little more challenging. After that, it's on to level 3. As you go through missions, we keep track of your progress and the choices you make. During each mission, a meter will tell you how you're doing. Your goal is to keep that meter in the green by making smart choices and providing effective care. When you finish and pass a mission, you'll earn 1, 2, or 3 stars based on how you did. Ready to take on more? Try one of the optional missions. If you're struggling with the missions, I highly suggest visiting the arcade. It's located in the mall and has a lot of helpful, fun games. They unlock as you go through your training and let you focus on specific responder skills. The level 3 missions are the big ones. You've got to get at least 1 star on each required level 3 mission to pass this course and move on to the in-person skills session. You'll even get a completion record you can print and bring with you to class. Well, I think that about covers it for now. Let's get started. Whether you realize it or not, you play a major role in the EMS system. The EMS system, that's the Emergency Medical Services System, is a network of resources that includes 911 dispatchers, police officers, firefighters, doctors, emergency medical personnel, and you. Once you recognize an emergency, you have a choice to make. Do I act? Do I help? Your most important job as part of this network is simply deciding to take action. There are so many ways you can help in an emergency, and I'm here to help you prepare for that. But the decision to act, that's all yours. Emergencies can be stressful and scary. When faced with a real emergency, you may think to yourself, I am not the right person to handle this, or I don't know this person or anything about her, so how could I really help? These thoughts, all your second guessing, are barriers to act. Fear of doing something wrong or of disease, being unsure of what to do, or even assuming someone else will help are all potential barriers to act during an emergency. So how do you prevent these thoughts from stopping you? First of all, know the facts. Contracting a disease while helping an injured or ill person is extremely unlikely. You can protect yourself and others by using personal protective equipment, like gloves or breathing barriers, when available. Also, just because there are a few people or even an entire crowd gathering at the scene of an emergency, that doesn't mean anyone is actually helping. Most states have Good Samaritan laws that protect people like us against claims of negligence when giving care in good faith. Of course, these laws vary from state to state. Check your local laws, statutes, and regulations for more information. All of these laws were created to encourage people like you to help others in emergency situations. Finally, and most importantly, you can help. Here, you'll learn how to help using the check, call, care process. When in doubt, remember, doing something is always better than doing nothing.
Let's finish up and get home. I'm starving.
Hey, Dad, can we get plantains?
Sure. I didn't know you'd ever had plantains. I could eat like 16 plantains right now. I don't think I've eaten it all today.
Dad? Dad!
I just feel lightheaded all of a sudden. I just need to sit down.
This looks like an emergency. In any emergency situation, follow the emergency action steps. Check, call, care. Before you can help an injured or ill person, you need to make sure the scene is safe for you, the person, and any bystanders in the area. When checking the scene of any emergency, use your senses and take note of unusual noises, signs, odors, appearances, or behaviors. As you look around the room, ask yourself, is it safe? Is immediate danger involved? What happened? How many people are involved? Is anyone else available to help? What is wrong? Seems like everything is okay here. Check the rest of the scene by looking to the right and the left. Use the arrows on either side of the screen to look around. Before you talk to bystanders, you should check the scene for safety. Before you help someone, you should always check the scene for safety first. Those avocados are way overpriced, but that's not a safety concern. Now check the rest of the room. Select the arrow on the left once to return to the center of the room and twice to check the left side of the room. Everything looks okay over here. No apparent hazards. Good work. There don't appear to be any hazards here. The scene is safe. Now that you've checked the scene, you need to check the injured or ill person. Select Barry to move a little closer and ask him some questions. Notice the white circles on screen? These indicate available action menus. You can select actions from these menus to interact with the person on screen and provide care. First, you need to obtain consent from Barry. Select Obtain Consent from the menu near Barry's head. That's right. Before giving care to an injured or ill person, you must obtain consent. To obtain consent, explain who you are, your level of training, what you see, what you plan to do, and ask if you can help. If a person verbally or visually agrees to care, this is known as expressed consent. If a person is unconscious or unable to respond, this is implied consent. If you're providing care to a child or infant, obtain consent from a parent or guardian if one is present. If one is not present and it is an emergency, then consent is implied. Once you obtain consent, you should interview the person to learn more about signs and symptoms. Before asking Barry questions, you need to obtain his consent for treatment. That's right. Before giving care to an injured or ill person, you must obtain consent. To obtain consent, explain who you are, your level of training, what you see, what you plan to do, and ask if you can help. If a person verbally or visually agrees to care, this is known as expressed consent. If a person is unconscious or unable to respond, this is implied consent. If you're providing care to a child or infant, obtain consent from a parent or guardian if one is present. If one is not present and it is an emergency, then consent is implied. Once you obtain consent, you should interview the person to learn more about signs and symptoms. Before asking Barry questions, you need to obtain his consent for treatment. That's right. Before giving care to an injured or ill person, you must obtain consent. To obtain consent, explain who you are, your level of training, what you see, what you plan to do, and ask if you can help. If a person verbally or visually agrees to care, this is known as expressed consent. If a person is unconscious or unable to respond, this is implied consent. If you're providing care to a child or infant, obtain consent from a parent or guardian if one is present. If one is not present and it is an emergency, then consent is implied. Once you obtain consent, you should interview the person to learn more about signs and symptoms. This is partially correct, but you need to go further than simply asking permission. You also need to inform the person about your training to build trust, and also explain what you see and what you plan to do so that they can make an informed decision when giving consent. Try again.
Yes, please.
Nice job. You've obtained consent to help Barry. In a sudden illness emergency, obtaining consent might sound like, "You seem ill, and I'm trained to respond to sudden illness emergencies. I'm going to help you. Is that okay?" Next, ask Barry some questions to learn more about what's wrong and determine if you need to call 911. Select Interview Barry from the menu near Barry's head to get started. When dealing with an injured or ill person, you'll want to check the signs and symptoms. Signs are what you hear, see, smell, and feel. This might be a broken bone or, in this situation, a man who appears tired and weak. Symptoms are what the person you're helping is experiencing, like pain in an arm or a racing heartbeat, or in this case, a feeling of dizziness and disorientation. The best way to determine symptoms is to ask the person about them so you can understand what's happening. Then, you should ask additional questions about medical history, allergies, and whatever else might make sense with the particular illness or injury so that you can more effectively provide care.
I just got really dizzy all of a sudden. No, I just feel really dizzy and tired.
It's not a good idea to try and move an injured or ill person unless it is absolutely necessary. Barry is not in any danger, so you should continue with your questions without moving him.
No. No medical conditions, and no medication. Oh, jeez, I don't feel so good.
Barry appears weak and said he is tired and dizzy. This means it is time to call 911. Throughout these missions, you'll learn more about when specific injuries or illnesses need advanced medical attention. When in doubt, make the call. For this emergency, you should send the cashier to call 911. Take a step back by selecting the back arrow in the lower left corner of the screen. During missions, you can contact EMS personnel yourself by selecting the phone icon at the bottom of the screen to call 911. In most emergencies, however, it is better to send a bystander to call instead. If you find yourself alone with an injured or ill person and you need to call 911, try shouting for help first. To shout for help during a mission, select the megaphone icon at the bottom of the screen. Select the cashier Bruno to talk to him and send him to call 911.
Yeah, no problem.
Nice job. And remember, when sending a bystander to call 911, it's always a good idea to also have them grab a first aid kit if one is available. Now, let's listen in on that 911 phone call. Normally, you would start providing care for Barry while Bruno is on the phone with 911. But for now, listen in on that call to learn more about the kinds of questions you'd be asked by a 911 operator.
This is 911. Where is your emergency?
450 West Ravenswood. I'm at the Green Galores supermarket.
What is the phone number you are calling from?
This is the store's landline. 555-312-1234.
What is the problem? Tell me exactly what happened.
A customer is complaining of feeling dizzy and weak. He fainted a few minutes ago.
How old is he?
He looks like he's in his late 30s, maybe early 40s.
Is he responsive or unresponsive now?
He's responsive now.
Is he having any difficulty breathing?
No, he's not having trouble breathing. He's breathing fine.
I'm sending paramedics to help you now.
Good work. From here, you remain with Barry to monitor his condition until help arrives. We'll stop here and review what you learned about the check and call steps in the check, call, care process. There are two types of wounds you may encounter as a first aid responder: open wounds and closed wounds. Simply put, open wounds have broken the skin and closed wounds have not. There are four main types of open wounds: abrasions, lacerations, avulsions, and punctures. Abrasions are caused by something rubbing roughly against the skin. They're more commonly known as scrapes, rug burns, or road rash. Lacerations, otherwise known as a cut in the skin, are commonly caused by a sharp object such as a knife. lacerations are not always painful because damaged nerves can't send pain signals to the brain. Avulsions are when part of the skin is torn away. This type of injury can cause significant bleeding. Puncture wounds are caused by a sharp object piercing the skin. Puncture wounds do not bleed much externally, but an object that goes into the soft tissues, such as a nail, can carry germs deep into the body and can also cause significant internal bleeding. Some wounds may require stitches. When it comes to deciding on stitches, a good rule is, if you have to ask yourself whether it needs stitches, it generally does. Certain types of open wounds need special attention or care. One example that you may come across often is a nose injury. Nose injuries are usually caused by a blow from a blunt object and often result in a nosebleed. High blood pressure or changes in altitude can also cause nosebleeds. To control bleeding from a nosebleed, have the injured or ill person sit slightly forward to stop blood from potentially running down the back of the throat into the stomach or airway. Then pinch the nostrils together. Make sure you're not pinching near the eyes. If a nosebleed doesn't stop after 10 to 15 minutes, help the person get to a healthcare professional or call 911 immediately. Here are some tools you'll be using in this mission. This is a dressing. You use this to apply pressure to a wound in order to stop the bleeding. And this is a bandage. Once the bleeding stops, you will wrap the wound with a bandage to hold the dressing in place. And remember, you should always call 911 in an emergency when bleeding is severe.
Something. Cut my leg on the rack.
Oh, man, you're bleeding. Oh, geez, that's a lot of blood. I am terrible with blood.
Yeah, it's bleeding pretty badly.
David's leg is bleeding badly. When a person is bleeding, you'll want to control the bleeding first thing after checking the scene for safety and obtaining consent. You should also have somebody call 911 as soon as possible. Not quite. First, check the scene for hazards. No hazards on this side of the room. Everything looks okay over here. Good. You've checked the scene, and there don't appear to be any hazards. The scene is safe. What should you say to obtain consent?
Yeah. Help me, would you?
Nice work. You've obtained consent. Now you need to get someone to call 911 so you can control the bleeding. There is already somebody here, so you don't need to shout for help.
Okay, I'll go call. I'll be back.
Arnold is calling 911. Now you can focus on controlling the bleeding. Nice job. Now you can interview David to learn more about his signs and symptoms.
I slipped in something over there and cut my leg on the rack. I feel okay. No, just the leg. No, just allergic to hurting myself, I guess. No medication.
Nice job. You've gained enough information. It looks like the bleeding has stopped. Now you can apply a roller bandage. Before securing the bandage, check the toes for feeling, warmth, and color. You need to do this to make sure there's still circulation below the wounded area. Okay, the toes look and feel good. So now, go ahead and wrap the wound. Drag the bandage to the wounded area. Nice work. Notice how the bandage extends beyond the wounded area, about an inch in either direction. Next, you'll tie the bandage. When wrapping an injury like this, tie the knot directly over the wound. This creates additional pressure in the area and helps control the bleeding. Drag the knot to the bandage now. Good work. Now that the bandage is tied, check the toes for feeling, form, and color again. Everything looks good here. Nice job. Okay, good. You're controlling the bleeding. Arnold's called 911, and EMS is on the way. Now that you've controlled the bleeding and learned about the person's signs and symptoms, you should monitor him for any changes in breathing or levels of responsiveness. Be sure to look out for faster or slower breathing, changes in skin color, and restlessness, as these could mean the condition is worsening. David's breathing seems good. Continue to monitor David until EMS arrive. Exposure to extreme heat or cold can make a person seriously ill. Let's take a look at some heat-related illnesses. There are 3 types of heat-related illnesses, and while all should be treated seriously, some are more dangerous than others. Heat cramps are the least severe of the 3. Heat exhaustion requires immediate attention, and a heat stroke is a life-threatening emergency. Heat cramps are painful muscle spasms. The best treatment for heat cramps is to move the person to a cool place, have him or her slowly hydrate with a sports drink or water, and help the person lightly stretch the muscle. And remember, don't ever give a person salt tablets, as this can worsen the situation. Signs and symptoms of heat exhaustion include cool, moist, pale, ashen, or flushed skin, headache, nausea, dizziness, weakness, and exhaustion. Heat exhaustion requires immediate care and can usually be reversed if recognized early on. First, move the person out of the heat. Then, loosen or remove as much clothing as possible and apply cool, wet cloths, making sure to re-moisten the cloths periodically. If possible, fan and mist the person with water. As with heat cramps, have the person hydrate with a sports drink or water if the person is awake and able to swallow. Call 911 if the person has a change in responsiveness, refuses fluids, or if the person's condition does not improve. Signs and symptoms of a heat stroke include extremely high body temperature, red skin that can be either dry or moist, changes in consciousness, rapid, weak pulse, rapid, shallow breathing, confusion, vomiting, and seizures. Heat stroke is brought on when heat exhaustion is not properly cared for. You'll learn more about how to treat heat stroke in the mission.
I'm fine. Now let's get back outside and finish the job.
No, we need to get you out of the sun for a minute.
Let's keep going. Sooner we finish, sooner it's done. Hand me the radio.
Brian, you don't look so good. Brian? Hey, Brian?
I'm fine. It's just hot. I got a killer headache. I'm fine.
Yeah, but your skin looks really red.
Where's that radio? I feel dizzy.
I'm going to find you some water. I'll be back.
Brian, a warehouse employee, does not look so good. He was just brought in from the loading dock. You notice Brian's breathing is shallow, he has red skin, and seems confused. Everything looks okay over here. No hazards on this side of the room. Good. You've checked the scene, and there don't appear to be any hazards. The scene is safe. What should you say to obtain consent?
Yeah, sure.
Good job. Now you can interview Brian to learn more about his condition.
I'm just hot.
Brian is showing signs and symptoms of heat stroke. He needs to be cooled immediately. You should stop the questions early and call 911 now so you can give immediate care. Okay, good job. You called 911 and EMS is on the way. Now you should give care.
Hey, I'm back. I couldn't find anything to help Brian. Is he all right?
You already interviewed Brian.
He's been out in the sun a long time. I think the heat got to him.
When a person is suffering from heat stroke, the best possible thing you can do is immerse the person neck down in cold water. Since you don't have that option in the warehouse, the next best thing you can do is to continuously spray the man with cold water from the hose. After cooling Brian, monitor him for any changes in responsiveness. Within minutes of cooling Brian, EMS arrived to take over. Good work. Muscle, bone, and joint injuries come in all shapes and sizes, and it's important for you to be able to recognize the different types in order to provide proper care. The four main types of muscle, bone, and joint injuries are fractures, which are a complete break, chip, or crack in a bone; dislocations, which is the movement of a bone at a joint away from its normal position; sprains, which involve the stretching or tearing of ligaments at a joint; and finally, strains, which is the stretching and tearing of muscles or tendons. When minor injuries don't require emergency medical attention, use the RICE method to care for injured muscles, bones, and joints. This stands for rest. Do not move or straighten the injured area. Immobilize. Stabilize the injured area in the position it was found. Minimizing movement can prevent further injury. Cold. Fill a plastic bag with ice and water, or wrap ice with a damp cloth and apply ice to the injured area for periods of about 20 minutes. If 20 minutes is too much to tolerate, apply for 10 minutes instead. Elevate. Elevate the injured part only if it does not cause more pain. Elevating the injured part may help reduce swelling.
Mr. Lawrence, I spilled my milk on the floor.
Well, you know what they say. No use crying over spilled milk. Ah, that really hurt.
Anthony slipped and injured his wrist. The injury does not look severe, so you won't need to call 911, but you can still help by giving care. Not quite. First, check the scene for hazards. Notice anything here? Nice work. You've identified the spilled milk as a potential hazard. Everything looks okay over here. No apparent hazards. Good work. You've checked the scene for safety and identified all potential hazards. What should you say to obtain consent?
Yes, please help. Thanks. it's just my wrist. It hurts pretty bad, but I'll be fine. No, I don't have any allergies. Nah, I don't take anything. I don't have any medical conditions.
Good work. You've interviewed Anthony. Now you should give care for his wrist. The wrist appears swollen, but the skin is not broken. How should you use the Rice method to care for Anthony's sprained wrist? Nice job. Now you should monitor Anthony for any changes in his condition.
Hey, thanks. That's definitely helping. And it's starting to feel better already.
Nice job. You used the Rice method on Anthony's wrist. First, you rested the area. Then, you immobilized it by wrapping the area with an elastic bandage. Finally, you applied ice to the injury while elevating it. Remember, when wrapping a wound, it's very important to check the fingers before and after for feeling, warmth, and color. This way, you can be sure there's still circulation below the wounded area. Now, you should suggest Anthony see a healthcare professional. Many people suffer from allergic reactions to certain foods, pollens, venoms, and antibiotics, among other things. A mild allergic reaction could be itchy skin or a rash from poison ivy, while other reactions can be more severe, such as anaphylactic shock. Anaphylactic shock is a life-threatening reaction where the airway can swell, making it difficult to breathe. If not treated, it could ultimately lead to death.
Are there peanuts in this sauce?
I thought you checked. Oh no. Did you eat any yet?
Yeah, I did. Oh, man.
Are you okay, Art?
I don't know. Oh, my throat is swelling.
Art is showing signs and symptoms of anaphylactic shock, which can be a combination of difficulty breathing, wheezing or shortness of breath, a tight feeling in the chest and throat, swelling of the lips, face, throat, or tongue, or weakness, dizziness, or confusion.
It's going to be okay. I'm calling 911. Do you have your epinephrine auto-injector?
When a person is suffering from anaphylactic shock, call 911 if the person has trouble breathing, complains of the throat tightening, explains that he or she is subject to severe allergic reactions, or if the person becomes unresponsive. Since Art had an epinephrine auto-injector, he used that to counteract the effects of the anaphylaxis. Before helping a person suffering from anaphylactic shock, be sure to confirm a history of severe allergies. Look for signs and symptoms of anaphylaxis. Find out if the person needs help administering the auto-injector, and check that you have the person's own prescribed auto-injector. It is also important to be familiar with your state and local laws related to helping with an epinephrine auto-injector.
Okay, the paramedics are on their way. How do you feel?
A little better, thanks.
While waiting for EMS to arrive, Candace will monitor Art's breathing and for any changes in his condition.
How are you feeling?
Oh, fine. Luckily, it wasn't a venomous snake.
Yeah, don't worry. We double-checked. It was just a garden snake. If it was a venomous snake, such as a copperhead or rattlesnake, you'd see swelling. You'd also be in a lot of pain.
I bet I'd also hear sirens, right?
Yeah, we'd call 911 right away for a venomous snake bite. Since this is non-venomous, we washed the wound with soap and water and controlled the bleeding using a dry, sterile dressing. Then, we wrapped the dressing in a roller bandage. Remember, any snake bite can cause an infection, so always look for discoloration or signs of infection after a snake bite. You'd want to get that checked out.
How would you give care for a venomous snake bite?
After calling 911 and waiting for them to arrive, we'd wash the wound. Apply an elastic bandage that is tight enough to slow the spread of the venom, but loose enough to slip a finger underneath. We'd also make sure to check above and below the injury for feeling and warmth. Oh yeah, there are some myths about cutting a wound, but we definitely don't do that.
How about sucking out the poison, or applying ice or tourniquet, or using electric shock from a battery?
Somebody's been watching too many old westerns. Those are all myths. Don't ever try any of those.
Good to know. Summer handled that environmental emergency really well. Select Summer to learn more about how to handle insect stings, as well as animal, spider, and tick bites in order to complete this mission.
Animal bites can be pretty serious depending on the animal. These are easy bites to spot, though. Signs of an animal bite include bite marks and bleeding. The first thing you should do is control the bleeding if the bite is bleeding severely. Then, wash the wound with soap and water and irrigate it with running tap water. Call 911 if the wound is bleeding seriously, or if you suspect the animal might have rabies. Try to remember the animal's appearance and where you last saw it. This information will help the 911 operator when they send animal control to the scene. There are lots of different types of insect bites. Some signs and symptoms of an insect sting include pain, swelling, an allergic reaction, or even a stinger in the person's skin. It's really important you remove any visible stingers. This can be done by using a plastic card and scraping the stinger away from the skin. Make sure you never use tweezers or pinch the area to remove a stinger. Once removed, wash the site with warm, soapy water and keep it clean. You can use a cold pack wrapped in a cloth or towel to reduce any pain or swelling. Finally, make sure to monitor the injured person for any allergic reactions. You should call 911 if the injured person has any trouble breathing. Great question. You can get very sick from the bite of an infected tick, so it's good to know how to treat this kind of bite. Some of the diseases spread by ticks include Rocky Mountain spotted fever, Babesia infection, and Lyme disease. To remove a tick, use fine-tipped tweezers to get as close to the skin as possible. Without twisting, slowly and steadily pull the tick upwards and hold for a few seconds. The tick should release itself out of the skin. Wash the area thoroughly with warm, soapy water. Finally, place the tick in a sealed plastic bag and see a healthcare professional to get checked for any tick-borne illnesses. While some spider bites are relatively harmless, others can be life-threatening. General signs and symptoms of spider bites may include a mark indicating a possible bite or sting, or severe pain in the sting area. For spider bites, wash the area with soap and water. It's a good idea to encourage the person to seek medical attention if the bite becomes infected, doesn't heal, or if the bite might have been caused by a poisonous spider. Call 911 if you suspect that someone has been bitten by a black widow spider or brown recluse spider, stung by a scorpion, or if the person has any other life-threatening conditions. So glad we could talk. I hope you feel more confident about the signs and symptoms, as well as general care for different types of bites and stings.
A poison is any substance that causes injury, illness, or death if it enters the body. A person can be poisoned by swallowing poison, breathing it in, or absorbing poison through the skin, or by having it injected into the body. Swallowed poisons include certain types of foods, prescription medication overdose, and household items such as cleaning products and certain plants. Inhaled poisons include gases such as carbon monoxide, ammonia, or chlorine fumes from household products like cleaners, paints, and solvents. Absorbed poisons can come from plants, such as poison ivy, or from fertilizers, pesticides, acids, or alkali. Injected poisons include insect, spider, jellyfish, and snake bites. It's important to know when to call 911 and when to call the National Poison Control Center hotline.
If a person is unresponsive or not breathing, or a change in behavior occurs, 911 would need to be called immediately. If you suspect a person has been poisoned and they are responsive and alert, call the Poison Control Center at 1-800-222-1222. Asthma is an illness in which certain triggers make breathing difficult. Asthma triggers include dust and smoke, perfume, exercise, plants, molds, or animal dander. Signs and symptoms of an asthma attack include trouble breathing or shortness of breath, rapid or shallow breathing with a wheezing sound, and sweating and tightness in the chest. If you see a child suffering an asthma attack and no parent is around, you might ask yourself, can I give care without the parent's consent? Well, the answer is yes, you can help, but you need to check with your state or local regulations to determine if you can help with his or her inhaler. If the parent or guardian is not present during a life-threatening pediatric emergency, consent is implied. If a parent or guardian is present during an emergency, obtain consent from him or her. If the parent or guardian does not give consent, then you should call 911, but do not give care.
Mom! Mommy!
Are you looking for your mother?
Where's my mommy?
We can find her. Come with me.
No,
Okay, don't worry. We'll find your mother. How are you feeling?
It's hard to breathe. Asthma. I have asthma.
Okay, just try to stay calm. It's all going to be all right. Alex, can you call 911? Do you have an inhaler with you?
It looks like Michaela has this emergency under control. Pay close attention to what she does.
In my pocket.
Okay, good. It's not expired. Can you use it yourself?
Okay.
Breathe in deeply. Now, hold it in while I count to 10, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Great job.
Notice how fast Michaela acted when responding to this emergency. Since Charlie's mother was not around, consent was implied. Michaela provided effective care and was reassuring when Charlie seemed nervous. While they wait for EMS to arrive, Michaela will monitor Charlie for changes in breathing and responsiveness. Seizures, stroke, diabetic emergencies, and poisoning are all common types of sudden illnesses. To the untrained eye, these emergencies may be tough to spot. For example, sometimes a person suffering a diabetic emergency might just look tired or confused. Rather than just writing off odd behaviors, it's your job as a first aid responder to recognize signs and symptoms in order to respond and give appropriate care. While there are specific signs and symptoms for each type of sudden illness, the most common is changes in levels of responsiveness. This could mean the person is confused, unaware of surroundings, or simply not alert. Call 911 if the person becomes unresponsive, has trouble breathing, chest pain or persistent abdominal pain, severe burns or swollen or deformed areas, vomits or passes blood, is suspected of ingesting a poison, or suffers a stroke or seizure, or if the person is suspected of an injury to the head, neck, or spine. The general rule is, when in doubt, call 911. Until help arrives, Your primary goals are to care for any life-threatening conditions, help the person rest comfortably, and watch for any changes in breathing or responsiveness. Always remember, no matter what sudden illness emergency you're responding to, use the check, call, care process to respond quickly and effectively.
Deborino, my break room buddy.
Wiley, please, I'm feeling funny.
Oh, sorry. What's wrong?
I don't know. I'm feeling numb and tingly. I need to lay down. Oh.
Deb? What's happening? Oh my gosh.
Deborah is having a seizure in the break room. You need to take action to make sure she is safe during and after the seizure. Your first priority should be checking the scene and removing any hazards you see. Notice anything here? Excellent. Chair has been moved out of the way. When a person is suffering from a seizure, the best way to check the scene is to make sure there are no objects around that could injure the person during the seizure. If you're able to, remove any nearby furniture or other objects that may injure the person. Everything looks okay over here. No apparent hazards. Good work. You've checked the scene for safety and identified all potential hazards. If this is the person's first time having a seizure, or if you're unsure whether it is, 911 should be contacted. But since there's a bystander present, you should have him call 911 while you continue to help Deborah. If this is the person's first time having a seizure, or if you're unsure whether it is, 911 should be contacted.
I've known her for years, and she's never said anything about seizures. Okay, but is she going to be all right? I think you need to put a stick in her mouth so she doesn't bite her tongue. Oh my gosh, should we hold her down or something?
Wiley here is giving you bad advice. You should never attempt to put anything in a person's mouth when he or she is suffering a seizure. Also, never try to restrain a person having a seizure. This could lead to further injury.
Okay, I'll go call 911.
Deborah's seizure appears to subside.
Oh.
Deborah seems responsive. Now, place Deborah in a recovery position. Her body is in what is called the recovery position. This position protects her airway. After a seizure is over, it's important to make sure the person is breathing. In this case, Deborah seems to be breathing fine, although she's a little shaken up. After a person has a seizure, it's very possible he or she will be unresponsive or not alert at first. It's also possible for a person to feel drowsy, confused, or embarrassed if the seizure happened in a public place. That's why it's important to comfort and reassure the person, check for injuries, and stay on the scene until help arrives or until the person is fully conscious and aware of his or her surroundings. As you continue to monitor Deborah, EMS arrive to take over. While head, neck, and spinal injuries make up only a fraction of all injuries, they can cause some serious problems, like speech or memory problems or paralysis. In some cases, they can even be life-threatening. In order to care for someone with this type of injury, you have to first be able to recognize the signs and symptoms. A head, neck, or spinal injury should be assumed in a number of situations, including those in which the person is unresponsive, was involved in a motor vehicle crash, fell from greater than a standing height, is wearing a helmet that is broken, complains of head, neck, or back pain, is not fully alert, or was injured while diving into a pool or other shallow body of water. A concussion is a traumatic brain injury that involves a temporary loss of brain function resulting from a blow to the head. Signs and symptoms of concussion are confusion, repeated questioning about what happened, temporary memory loss, nausea and vomiting, speech problems, blurred vision or light sensitivity, and headaches. If you suspect a person has suffered a concussion, call 911.
Manny, I think you might need to move the ladder. Nah, I can reach. You're making me nervous. Everything makes you nervous. You're a nervous guy. That's your thing. Really? Do people say that? Who said that? Look, see? I got them. Didn't even have to move the ladder. Oh, my head.
Manny fell off a ladder and hit his head. In this type of situation, the best way you can give care is by calling 911 and minimizing the person's movement. Not quite. First, check the scene for hazards. Notice anything here? Nice job. You identified the rolling ladder as a potential hazard. Everything looks okay over here. Good work. You've checked the scene for safety and identified all potential hazards. There's a bystander here. You should ask him to call 911 so you can focus on giving care to Manny. There's a bystander nearby, so you don't need to shout for help.
Okay, I'll go call now.
What should you say to obtain consent?
Huh? Yes, please.
Okay, you obtained consent. Your next step is to put your hands on either side of Manny's head in order to limit further movement. Nice job. Make sure to keep the head still, supporting it in the position you found it. If, for example, you had found Manny with his head turned sharply to the side, you would keep the head just like that until EMS arrived to take over. This question might tempt Manny to try and move his head, which you don't want to happen, since this could cause further injury.
I'm not... What happened? Yeah, my head. What happened? What happened? No, Who are you? I don't take any... No.
Good job. You've gathered enough information. Good job. You should continue to monitor Manny while holding his head still until EMS arrive to take over. For infants and young children, a fever can indicate a specific health problem. Most of the time, this means a minor issue, such as an ear infection, but some fevers may signal a more serious problem. For example, a rapid rise in body temperature in an infant or young child up to the age of 6 can cause febrile seizures. Most will last less than 5 minutes and are scary, but often not dangerous. Signs and symptoms of a febrile seizure include a blank stare, confusion, drowsiness, crying, becoming rigid, holding breath, upward rolling of the eyes, and uncontrolled muscular contractions called convulsions, which last several minutes. Just remember, you can't stop a seizure, but you can still help by preventing injury, making sure the airway is open after the seizure ends, and protecting the airway. It is also essential to note that the first time an infant or child has a seizure, 911 should be called immediately.
And over here are the babies.
Aw, they're so cute. I'm so excited to be working with kids.
Hey, sweetie. Oh, wow. You feel really warm. I think she might have a fever, actually. We might need to call her parents.
Oh no, what's happening?
Brielle begins having a febrile seizure. Remember, you can't stop a seizure, but you can prevent injury. Make sure the airway is open after the seizure ends and protect the airway. In this situation, since a parent or legal guardian is not present, consent to give care is implied. Not quite. First, check the scene for hazards. Everything looks okay over here. No apparent hazards. Everything looks okay over here. Good. You've checked the scene, and there don't appear to be any hazards. The scene is safe.
Of course, I'll go call now. I'll also call the parents.
Even though consent is implied, it's still a good idea to inform the adult responsible on how you plan to give care. In this situation, you would explain that the baby is having a seizure, and the best thing anyone can do is keep the baby safe from further harm and protect the airway. It may be tough to watch a baby having a febrile seizure, and you may feel tempted to pick up the baby. Don't do this. Just remember, the most important things you can do are prevent injury, loosen any light straps or restrictive clothing, protect the airway, and make sure the airway is open after the seizure ends. Brielle's seizure has ended. Now, check for any injuries. Brielle has no apparent injuries and seems to be breathing fine. Now, cool the body immediately by giving Brielle a sponge bath with a lukewarm sponge. Great job. Keep in mind, it is very important not to cool too much or too rapidly, as shivering could cause another seizure. Now, continue to monitor Brielle, ensuring her airway is open until EMS arrive. Half of all exposures to poisonous substances involve children under 6. While there has been a decrease in recent years from child-resistant packaging and other prevention techniques, it is still important to recognize the signs and symptoms of poisoning. Common signs and symptoms include nausea and vomiting, chest or abdominal pain, changes in responsiveness, and burns around the lips, tongue, or skin. If you suspect a child or infant has swallowed a poison, try to find out what, when, and how much they took, as well as the child or infant's weight. If a child is unresponsive or not breathing, or if a change in behavior occurs, call 911 first. If you suspect a child has been poisoned and they are responsive and alert, call the Poison Control Center at 1-800-222-1222.
Lily, what do you have there?
Hi.
What is that? Are those pills? Where did you get my medication?
Candy.
Oh no, you went into my purse? Oh no, you poor thing. Are you okay?
Emily, a daycare worker, just realized Lily ingested some of her medication. It's time for you to give care. When you suspect a child or infant has ingested a poison, the first thing you should do is remove the child from the source of the poison. In this case, Emily put the medication into her pocket to keep Lily from ingesting more. No hazards on this side of the room. Everything looks okay over here. No apparent hazards. Good. You've checked the scene, and there don't appear to be any hazards. The scene is safe. Remember, if the parent or legal guardian is not present, consent is implied. First, you need to call for help. There is already someone else here, so you don't need to shout for help. In this situation, because Emily is not the parent or legal guardian, and because the child's condition may be life-threatening, consent is implied. Now, you need to interview Emily in order to learn more about what happened. When interviewing a person, your main goal is to quickly learn about his or her signs and symptoms, as well as medical history. The typical questions are, what happened? How do you feel? Do you have any allergies? And do you take any medication? In this case, you will interview Emily, and you'll be asking a couple more questions that deal directly with poison emergencies. See if you can choose the most effective questions.
I looked away for 1 minute. Then next thing I know, Lily has my medication in her hand. She must have gone into my purse. Yes, she's acting normally.
There are more important questions you should be asking.
No, she doesn't. No, not that I'm aware of. I don't know exactly. I think 2 pills? And it had to be within the last 10 minutes that she took them. She's about 35 pounds.
Okay, you've got enough information. So, who do you call? 911 or the National Poison Control Center hotline? When giving care in a poison emergency, there are 2 numbers you should know: 911 and the National Poison Control Center hotline at 1-800-222-1222. If a person is unresponsive or not breathing, or if a change in their behavior occurs, call 911 first. If you suspect a person has been poisoned and the person is responsive and alert, call the National Poison Control Center hotline. You should have the bystander make the phone call while you continue to monitor Lily.
Who do I call? 911 or poison control?
Lily is responsive and alert, so 911 doesn't need to be called.
Okay, I'll call them.
Since Lily is alert and awake, calling the National Poison Control Center hotline is the correct move. If Lily begins to show any changes in her signs and symptoms, then 911 should be called. Now that Emily is handling the phone call, you should monitor Lily. Lily is responsive and seems to be doing well. Continue to monitor Lily and follow the instructions given by the National Poison Control Center hotline. Make sure not to give the child anything to eat or drink unless instructed to do so.